Well, I am Ruben Restrepo, and we are talking about the coronavirus disease and his effects around the world. And the coronavirus is named also COVID-19. So we start. And the coronavirus disease, COVID-19, is an infectious disease caused by a newly discovered coronavirus. Most people infected with the COVID-19 virus will experience mild to moderate respiratory illness and recover without requiring special treatment. Older people and those with underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease, and cancer are more likely to develop serious illness. The best way to prevent and slow down transmission is be well informed about the COVID-19 virus, the disease it causes, and how it spreads. Protect yourself and others from infections by washing your hands or using alcohol-based route frequently and not touching your face. The COVID-19 virus affects different people in different ways. COVID-19 is a respiratory disease, and most infected people will develop mild to the moderate symptoms and recover without requiring special treatment. People who have underlying medical condition and those over 60 years old have a higher risk of developing severe disease and health. Common symptoms include fever, tiredness, dry cough. Other symptoms include shortness of breath, um, ache of pains, sore throat, and very few people will report diarrhea, nausea, or a runny nose. People with symptoms who are otherwise healthy should self-isolate and contact their medical provider or a COVID-19 information line for advice on testing and referral. People with fever, cough or difficulty breathing should call their doctor and seek medical attention.
Well, let's start by talking about where the pandemic originated China. The first thing what happened was several people entered to the emergency room with the same symptoms. One doctor was the first person to warn and alert that it was a rare and different virus, but the government wanted to keep it quiet, which is very, very strange. But let's continue. After that, was discovered that all the infected people had gone to a seafood market in Wuhan, China. What continued was that more people became infected and died, including the doctor who first reported. In Wuhan, the epicenter of the coronavirus, they built a hospital in 10 days to deal with these cases. Due to the rapid spread of the virus, they quarantined the city and its inhabitants, but were slow to do so, and many people managed to travel to other parts of China and the world. When the situation worsened, some neighboring countries closed borders with China, canceled flights to and from China, and so it was recommended that no one leave their homes unless it was strictly necessary, such as looking for food. They also took the temperature and tested absolutely everyone who was on the street, and also when entering and leaving one city to another. Another thing that has been implemented is cleaning all the busiest places. There was panic when some patients that had been discharged were newly infected with the disease. In China, there are no new local cases, but approximately 34 foreigners. But it is still a great advance. Even several doctors have gone to provide their services to Italy, that is the second country with the most infected people. On the other hand, pollution has been reduced considerably worldwide, but especially in China, since many companies, factories, etc., have made the decision not to work to take care of the health of all their employees. Furthermore, the consumption of certain animals has been banned, which is beneficial to the environment as well.
Hello, I'm Marta, and now I am going to talk about the Italian situation. And well, Italy's case is one of the most difficult right now in the world. And it is because there were not considered the right measures from the beginning of all this problem, and also there were many people moving across the country searching for a way to go out, and this only caused the propagation of the virus in all the country. Well, in Italy the quarantine began on 10th March, and it means 5 days before Spain. But now Italy is the country with the highest number of deaths from the coronavirus in the world, even surpassing China. And well, the country's first known cases were two visitors from Wuhan, China, and they were detected on January 29. Those visitors were placed in isolation in a hospital room, and the wheels of the national response began to grind forward. And well, now Italy has more than 53,000 recorded infections and more than 4,800 deaths. And the rate of increase keeps growing every day, with more than half the cases and fatalities coming the past week. On Saturday, the official statements, they say there were around 793 deaths, and this is the largest number of deaths in a single day. Well, Italy has surpassed China as a country with the highest death toll, and it has become the epicenter of a shifting pandemic. But well, there are some preventive measures that have been taken in this country, and as for example that the Italian Prime Minister has been taken to the streets except for extreme necessities, and also this is until April 3rd, with the intention of curbing the massive contagion that the country is going through right now. Also, on Saturday night, the Prime Minister announced another drastic step for the country, and he called this the country's most difficult crisis since the Second World War. And well, it's that Italy will close its factories and all production that is not absolutely essentials. And well, this is an enormous economic sacrifice, but it's intended to contain the virus and protect the lives of people in this country.
In the case of Colombia, the preventive measures that mayors and governors wanted to take in advance were stopped by the President Iván Duque, which has meant that there are more infected people in the country. When the world is going through a pandemic and has not reached to your country, it's easy to think that preventive measure seems like an exaggeration. But when the virus arrives and spreads, it seems that efforts are not enough. Although in Colombia there have been no cases of deaths from coronavirus, the way which it is intervened is not enough because the number of cases is not controlled, and every day there are more infected. And all these measures that they are going to try to implement abruptly and after time hit the poor population that doesn't have a roof or food to protect themselves.